It's Monday, October 31st, 2022. I'm Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. We're going to take a look at actually something that's not ozone therapy. If you'll notice the title here, this is the 2022 AAFP and AAHA Antimicrobial Stewardship Guidelines. And so these guidelines come in the face of really a major crisis, and that is antimicrobial resistance. And it's not only with bacterial infections, but antimicrobial resistance has an effect when we overuse antimicrobials. And bacterial infections become systemic or stick around and we can't deal with them. It affects our immune systems. It affects the ability of viral infections and fungal infections to pervade, and it really is a massive issue. So we have this position statement. Antimicrobial stewardship, as defined by the American Veterinary Medical Association, refers to the actions veterinarians take individually and as a profession to preserve the effectiveness and availability of antimicrobial drugs through conscientious oversight and responsible medical decision making, while safeguarding animal, public, and environmental health. So the entire profession needs to recognize that the use of antimicrobials and the ability then of the bacteria to adapt and change in such a way that antimicrobials are no longer effective is a massive issue. There's things that need to be done that we need to be aware of. One of those things is preventing or correcting infections whenever possible, and recognizing the risk factors that come with doing other things or with other events taking place, like wounds or environmental factors. Immunosuppressive drugs is a big one. So when we utilize things like chemotherapy, which at times can be helpful, we need to be aware that it's suppressing the immune system, and there's a much higher likelihood that infections are going to take place. So when we can use something like ozone therapy that doesn't have an immunosuppressive element to it, it's only going to be a win-win scenario. Therapeutic alternatives should be considered before or in conjunction with antimicrobial therapy. And of course, the therapeutic alternatives they're referring to have nothing to do with ozone therapy. However, they should, because this is an alternative that has proven effective and safe, and we should consider it when we're dealing with bacterial infections. So take a look at some of these highlighted things. Practitioners should strive to rule out viral infections, parasitism, toxicosis, nutritional imbalances, neoplasia, and other ailments that will not respond to antimicrobial therapies. So there's certain illnesses and conditions that don't respond to antimicrobial treatment. And some of those are upper respiratory infections, pancreatitis, feline lower urinary tract disease. You don't need it for routine dental prophylaxis or after tooth extractions necessarily. Debridement of infective tissue is sufficient to control infections in areas of in peripheral tooth root abscesses and other things. So another one is acute diarrhea. It just is not a case where we need antimicrobials. So what could you do instead? Well, again, I'm going to point back to ozone therapy being a wonderful adjunct treatment to have in the clinic to go ahead and treat these animals, because ozone is something that helps with viral, fungal, bacterial, yeast. All of these types of pathogens can be treated with ozone therapy. So the therapeutic antimicrobial use should be applied appropriately in the surgical setting. Again, in surgery, ozonated fluids is a fantastic substance to have on hand to deal with the potential for infections. Consider using other antimicrobials for initial therapy. Ensure any use of antimicrobials considered important in treating refractory infections is supported by the lack of another antimicrobial option, or the presence of cytology, culture and susceptibility testing, and a reasonable chance for a cure. So we need to be aware of this issue, and we need to be together recognizing that we can do something. And you, if you use ozone therapy, have a tool. And that tool is powerful, and you need to take it out and use it effectively in your practice and help other veterinarians or pet owners to do the same. Well, this has been 5 Minutes of Proof. I hope to see you next time.